An update to a story you first saw on Local 23. Plans to create a micro-hospital moving forward in South Padre Island. Today, a discussion to improve health care for the destination city and the surrounding areas. Alfredo Cuadros speaks one-on-one with the program's main supporter, who details how soon we may see an urgent care facility.
Good evening, Brenda. Conversations continue in South Padre Island about the creation of a medical facility in South Padre Island. However, an update today talking about more than just an emergency room.
A couple of months ago, we approved to do a study to see if there's a need for a hospital, and that feasibility study showed that yes, there is. And so now we're looking at the next step would be to survey the residents and others.
Today, the EDC approved a proposal for a national advisory firm to conduct research on what services are needed for SPI residents. Services like physicians, optometrists, cardiologists, among others. This in addition to the proposed emergency room.
I mean, we know we need an emergency room and that type of care, but we also need primary care. We don't want everybody with minor illnesses going to the emergency room. We need primary care.
When asked about the possibility of setting up in Port Isabel, Dr. Ibarra says the movement wants to remain centralized in SPI.
We made a decision long ago that we could have done it in Port Isabel or Laguna Vista. Laguna Vista already has a healthcare center, but we want to focus on the island.
And the project is looking to move fast. According to Dr. Ibarra, we may start seeing some signs of the emergency room in place as early as in the next 3 months. From South Padre Island, Alfredo Cuadros, KBEO, Local 23 News.
Right, Alfredo, thank you. One of the proposed sites for the new micro-hospital is near the intersection of Retama Street and Padre Boulevard. That's across from the fire station.